Welcome to PsychEd. This video explains the characteristics of autism spectrum disorder, or ASD. Let's dive in. What is autism spectrum disorder? Autism spectrum disorder, or ASD, is a neurodevelopmental condition that affects how individuals communicate, interact socially, and engage with the world around them. It's called a spectrum because it varies widely. Some people may need significant support, while others might navigate daily life with minimal assistance. In 2013, the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, made significant changes to how ASD is diagnosed. Previously, conditions like Asperger's syndrome and pervasive developmental disorder were diagnosed separately. However, the DSM-5 grouped these under the single diagnosis of ASD. This change emphasized two core areas of difficulty for diagnosis: social communication and interaction, and repetitive behaviors and restricted interests. For a diagnosis to be made, challenges in these areas must impair daily functioning. Boys are diagnosed with ASD more frequently than girls. There are a few reasons for this disparity. First, the diagnostic criteria is based on boys. Historically, the diagnostic criteria for ASD were developed based on research conducted primarily on boys. This means the criteria reflect how ASD typically presents in boys, potentially overlooking traits more common in girls. Second, social masking. Girls with ASD often exhibit better social masking skills. They may imitate social behaviors, which can hide their challenges from parents, teachers, or clinicians. Third, differences in symptom expression. Girls with ASD might display subtler traits, such as having intense but socially acceptable interests, like animals or fictional characters, whereas boys' interests might be more stereotypically restricted, like trains or numbers. As a result, many girls are diagnosed later in life or remain undiagnosed altogether. Autism spectrum disorder, or ASD, is defined by two broad categories of characteristics. Let's break them down with examples. Social communication and interaction. People with ASD often struggle with both verbal and nonverbal communication, which affects their ability to connect with others. These challenges can include social-emotional reciprocity. This refers to the back-and-forth flow of communication. People with ASD may not initiate conversations or respond appropriately. Conversations can feel one-sided, and responses might sometimes seem unusual, for example, touching or licking instead of speaking. Non-verbal communication. Individuals might not use facial expressions frequently or appropriately. For instance, their facial expressions might not match the topic of conversation. They might also misunderstand personal space, sitting too close or turning away during interactions. Maintaining relationships. Understanding social rules can be difficult. Someone with ASD might ask overly personal questions to a stranger or miss nonverbal cues that indicate discomfort, making it hard to form or maintain friendships. Repetitive behaviors and restricted interests. This category includes behaviors and preferences that are rigid or narrowly focused. Examples include repetitive behavior patterns, using the same words repeatedly, known as echolalia, speaking in an unusually formal or pedantic manner, sometimes called little professor syndrome, repetitive movements like spinning, rocking, or lining up objects, routines and rituals. Inflexible routines, such as playing with toys in the same exact way every time. Reacting strongly to changes, like being upset if breakfast isn't served at the usual time. Restricted interests. Intense focus on one particular object, topic, or activity, often to the exclusion of everything else. Unusual reactions to sensory input. A strong aversion to touch, such as disliking hairbrushing. Distress at certain sounds or lights. An obsessive interest in objects' movements, like spinning wheels. Indifference to pain, whether their own or others. Autism spectrum disorder is a complex condition that presents in many different ways. By understanding its key characteristics, we can appreciate the diversity of experiences among people with ASD. If you found this video helpful, be sure to like, subscribe, and let us know your thoughts in the comments below.